The health information contained herein is provided for educational purposes only and not intended to replace discussions with a healthcare provider. All decisions regarding patient care must be made with a healthcare provider considering the unique characteristics of the patient. When starting any new treatment, it's important to discuss possible side effects of your treatment with your healthcare team. Knowing what may arise can help you know what to do in the case of a severe reaction. It will also prepare you to take steps to minimize any discomfort. These are some side effects of the most common lung cancer treatments: pain, discomfort, exhaustion, nausea, diarrhea, rash. It's helpful to write down how you're feeling and track your side effects. Consider it a roadmap of your day-to-day experiences. You can even take notes on your phone or on an app. Note changes and track your progress so you can remember what to share with your healthcare team. Depending on the severity, you may want to share this immediately or wait until your next appointment. It's important to let your healthcare team know of any changes you notice in your body. Sometimes a small or seemingly insignificant side effect can become serious if it's not addressed early on. Your healthcare team will help assess your progress and health throughout treatment with regular physical exams, medical tests, and scans. These follow-up scans are an important part of your treatment and care. You may feel what people refer to as Scansiety, which is the worry that accompanies follow-up lung scans and the results they may bring. Talk to your family and friends about how you are feeling. You can even learn from people living with lung cancer how they've dealt with this stress in between scans and while waiting for results. If possible, try using mindfulness apps and/or listening to soothing music in preparation for your scans or during them. We will talk more about this in our next section, support. But first, let's recap. What to know. Communicate with your healthcare team. Know most common side effects of your treatment. Monitor lung cancer with regular scans. What to do. Continue to have dialogue with your doctor about side effects. Keep track of your progress. Share any positive changes.